Hello, I'm Chaine Wyon, and today we are going to talk about atrial fibrillation, also known as AFib. So, to understand what AFib is, we first need to talk about the conduction system of the heart. If you see here on the left, we have a normal conduction system throughout the heart. The SA node, or the sinoatrial node, is the natural pacemaker of the heart, and it tells the atria to contract. After doing so, the atrioventricular node, the AV node, will then take over and carry the command down to the rest of the heart. But if you see here on the right side, instead of the conduction system going through the SA node, there seems to be multiple commands firing off at different points and times within the atria. This will cause an irregular heartbeat, atrial quivering, and eventually cardiac remodeling, or some other types of remodeling, which we'll get to later. Okay, so what are some common signs and symptoms of AFib? Well, if your atria are not contracting the way that they're supposed to, you could start to experience many symptoms. A few would be things such as palpitations, or difficulty in breathing, chest discomfort, or even things like fainting or generalized fatigue, anxiety, or depression. As you can see here, there are many risk factors that put you more at risk for AFib. Of course, there are things you can't avoid, such as age and family history. But other things like high blood pressure, alcohol consumption, smoking, and obesity are things that we can control and maintain. Diagnosis of AFib can be made in multiple different ways, but the most frequent and probably the most effective method is the 12-lead EKG, or electrocardiogram. Now, a lot of patients will actually be completely asymptomatic. They won't have any symptoms at all, and they'll get an ECG for unrelated reasons. And unfortunately, on the ECG, we'll discover that they have AFib. Now, for the majority of the other patients, though, the ones that have symptoms, an ECG is usually what we go to first. Now, other methods can be used, such as a Holter monitor, or an event recorder, or even an echocardiogram. Now, keep in mind these other methods can not only be extremely useful for the diagnosis, but can also draw more value in ruling out other potential causes or diseases. Things like blood tests, stress tests, chest x-rays, pulse oximeters, multiple symptoms coming together, or even heart rates or auscultation, listening to the chest or the heart with a stethoscope. These are also great ways to find or detect or diagnose AFib, but for the most part, they're also very useful in helping us rule out other things that it could be. Now, let's go back to the remodeling discussion we had earlier. There are 3 different types of remodeling that can happen to the heart, especially with someone experiencing AFib. You could have cardiac remodeling, structural remodeling, or electrical remodeling. These are physiological changes that occur in patients suffering from AFib. These are changes to the structure of the heart and can become detrimental to the patient. But thankfully, the remodeling can be reversed with optimal treatments. We have treatments such as medications. Several medications can actually help reverse cardiac, structural, or electrical remodeling of the heart. But also, typically a really good medication that we give all patients suffering from AFib are going to be anticoagulants. Now, the reason for this is when the atria are quivering, they don't fully release all the blood they're holding. With that being said, some of the blood in there can sit in there and stay stagnant for a little too long. As we all know, when blood stays stagnant or doesn't move, it likes to clot. And eventually, if that blood does end up clotting up and then gets pushed into our ventricles and then out to our body, we now have a free-floating clot that can go to our brain or some other destination, which can cause some major issues. So with all patients with AFib, we typically give them an anticoagulant. Some other treatment options would be an implantable pacemaker. This is a device that we implement to the patient that keeps track of the heartbeat and the heart rate. And when the pacemaker notices the atrias quivering, it'll actually shock the heart to reset the automaticity factor, letting the SA node take back over. And lastly, we have a radiofrequency catheter ablation. Now this is where we go in and they'll actually zap the specific areas that are making their own electricity within the heart, their own signals within the heart. And then doing this will eliminate those extra pathways, which will allow the SA node to take back in control. All right, and lastly, let's figure out how we can go about avoiding this disease altogether. As you can see, AFib prevention is based heavily on lifestyle habits. Making changes in your daily routine can potentially pave the way for a healthier you. Even taking small steps such as quitting or severely reducing your nicotine or alcohol consumption can greatly reduce your potential risk. And with that, I want to say thank you to everyone watching. And please, if you have any questions, feel free to leave a comment down below, and I'll respond as soon as I can. Again, I'm Chaine Wyon, and thank you for watching, and I hope you have a great day.